Okay, here's something to think about. What if? What if something like narrowed arteries in your neck
Yeah.
could be quietly affecting how you think, how you learn, remember things,
Hmm.
even without you ever having a full-blown stroke?
Hmm. That's that's a really fascinating
It
question.
is, isn't it? Especially when you think by 2030, something like 20% of the U.S. population will be 65 or older.
And that's precisely when having sharp cognitive function is, well, absolutely crucial. It really matters.
It really does. And that's exactly what we're diving into today, cognitive function.
Right. That whole complex dance of thinking, learning, memory.
Problem-solving, awareness,
Yeah.
all of it.
Yeah, it's vital at any age, but you're right, its importance really ramps up as we get older.
So in this deep dive, we're exploring a connection that maybe isn't so obvious.
Hmm.
The potential link between carotid artery disease, the narrowing or blockage in those big neck arteries, and these subtle dips in our cognitive abilities.
And we're drawing heavily on Rutherford's vascular surgery and endovascular therapy for this. It's a great resource.
Absolutely.
And it's really important to be clear right from the start.
Yeah.
We're not just talking about the cognitive issues that can happen after a stroke. That's kind of well known.
Right, we know about that.
Our focus today is more on those subtle cognitive impairments, the ones that might pop up because of carotid artery problems without a stroke ever happening.
Okay, so subtle changes, not necessarily stroke-related.
Exactly. And this is a big deal because cognitive dysfunction is actually really common in older adults, affects maybe 20% of them.
Wow, 20%.
Yeah, so even without a stroke, issues with these arteries could be impacting how a lot of people think.
So our mission today, then, is to really unpack this potential link,
Right.
carotid disease and cognitive decline. Explore how it might happen, the mechanisms.
And importantly, look at whether treating the artery problem can actually help someone's cognitive function. Can we make a difference?
Okay, let's start with basics. What's the key distinction we need to grasp between different kinds of brain issues here?
Okay, so the core difference, right, is between what we call neurological deficits and cognitive deficits.
Neurological versus cognitive.
Got it. Think of neurological deficits as being pretty specific, like weakness in an arm after a stroke. It hits a particular function.
Localized.
Exactly. But cognitive deficits, they involve much broader brain systems. It's not about losing one single ability, necessarily.
Oh, okay.
It's more about a decline in the overall systems that handle things like, say, learning new information or processing things quickly.
So it's less about a physical limitation and more about how we process the world, how we think.
Precisely. And that subtle cognitive dysfunction, even if it's not dramatic, well, it has real-world consequences.
What kind of things are we talking about? Day-to-day impact.
Oh, it can be quite significant. People might find work harder, struggle with everyday tasks you wouldn't normally think twice about.
Like managing finances or appointments.
Yeah, exactly. Or maybe issues with driving safely, difficulties in social settings, even straining family relationships.
And you said these often go unnoticed.
Well, yeah, because they can creep up slowly, and routine checkups might not pick them up easily. But they still have this cumulative effect on quality of life, potentially on healthcare costs, too.
That's a crucial point. These subtle things can have big ripple effects. Now, this idea, neck arteries affecting thinking,
Mm.
it's not totally new, is it?
No, not at all. Actually, the first hint goes way back, 1951.
Wow, okay.
Yeah, a Dr. Fisher. He was looking at brains after death, and he suggested that carotid stenosis, the narrowing, might actually lead to something like dementia.
Really? Back in 51?
Yep. And he even proposed that maybe, just maybe, fixing the blood flow could reverse that decline. Pretty forward thinking for the time.
That is fascinating. So that thinking really set the stage for early carotid surgery.
It absolutely did.
So if that idea was around then, why did the big medical focus shift so heavily towards stroke prevention when it came to carotid disease?
Well, it was kind of the pressing crisis, right? Stroke was and still is a huge public health issue, a major cause of death.
Okay, that makes sense.
And they figured out that atheroembolization, little bits of plaque breaking off the carotid artery, traveling to the brain.
Causing blockages.
Exactly. That was causing a significant chunk of strokes. So understandably, the main goal became stopping those devastating strokes.
Right, prevent the big, immediate, life-threatening event. That would naturally be the priority.
It would. So the other side of it, the more insidious impact on cognition without a stroke, that kind of got over. The idea that carotid stenosis could be quietly messing with cognitive function, even if no stroke occurs, That's really regaining significant attention now.
And there's some specific evidence pointing that way now, isn't there? I think I remember reading about a study.
You might be thinking of the Cardiovascular Health Study. That was a big one.
Yes, that sounds familiar.
So in one part of it, they followed a group, including about 32 people who had significant narrowing, like 75% or more in their left carotid artery.
Right.
And these folks hadn't had any stroke symptoms. Asymptomatic.
Right.
Over 5 years, they saw something pretty striking. About 34% of those patients showed a significant cognitive decline, even though they didn't have a stroke during those 5 years.
Wow. 34%.
Yeah. And interestingly, they saw a similar decline in people with stenosis of 50% or more, too.
And this was compared to?
Compared to the rest of the cohort, thousands of people who didn't show that same level of cognitive dip.
So even without a stroke, the narrowed arteries seemed linked to worsening cognition.
It strongly suggested that yes, even though the researchers themselves were cautious.
How so?
Well, they pointed out it was preliminary, the group with stenosis was relatively small, and the cognitive tests used weren't maybe perfectly suited for this specific question.
Okay, fair enough.
But still.
Still, it definitely raised a flag. It spurred more research into this specific connection.
Okay, so if doctors suspect this might be happening, how do they actually assess cognitive function? It sounds complex.
It is. It's not like checking blood pressure.
Yeah.
Cognitive assessment is a detailed process.
It looks at various thinking abilities, learning, memory, problem solving, alertness. These are grouped into functional domains.
Domains. They're different categories of thinking.
Exactly. Each managed by specific brain systems. We look at things like attention, concentration, memory, different kinds, short-term, long-term.
Okay.
Executive functions, that's planning, decision-making, organizing.
Important stuff.
Very. Also processing speed, how quickly you can handle information, language skills, verbal abilities, perception, like spatial awareness.
And even motor skills. How does that fit in?
Yeah, surprisingly, fine motor control can be linked to cognitive processes, so it's quite broad.
So it's definitely not just one quick test then.
Oh, absolutely not. Each domain has different facets, so you usually need a range of tests, a battery of tests to get a full picture.
A battery, okay.
Some tests might even combine different subdomains. It's like checking all the different systems of a complex machine.
Are there any common screening tests people might have encountered? Like a quick check?
Yeah, there are a couple you might hear about. The Mini Mental State Exam, the MMSE.
Heard of that one?
Developed back in '75. It's pretty quick, maybe 7 or 8 minutes. Looks at orientation, recall, language, attention, basic stuff.
Okay.
Then there's the Montreal Cognitive Assessment, the MoCA. Came later, '96. Takes a bit longer, 10, 12 minutes. Adds things like drawing a clock, connecting dots.
A bit more involved.
A bit. And the MoCA is generally seen as maybe a little more sensitive than the MMSE.
But are they good enough for this specific issue? Vascular cognitive impairment from carotid stenosis?
Well, that's the thing. They're good screening tools, but they aren't definitive diagnostic tests.
Right.
And they were mainly designed for more general dementias, like Alzheimer's, which often affect the brain more globally.
Okay.
So they might not be sensitive enough to pick up the more specific, maybe subtle cognitive changes we sometimes see with vascular issues linked to carotid stenosis.
Why is that?
Think of it like... The general tests are good at spotting a major power outage across the whole city. But vascular cognitive impairment from carotid stenosis might be more like localized flickering lights in a few neighborhoods, harder for the main grid monitor to detect.
That's a great analogy. So researchers needed something more targeted.
Exactly. Because the general screeners have limits for this, researchers started putting together cognitive test batteries specifically designed for carotid stenosis patients.
Trying to catch those flickers.
Precisely, like the ACOF studies that stands for Asymptomatic Carotid Stenosis and Cognitive Function. One of the chapter authors leads that.
Oh, okay.
The goal is to find a set of tests that's thorough enough to detect subtle changes, but also practical, feasible to do in maybe 30 minutes or so in a clinical setting.
Right, finding that sweet spot between detailed and doable. Okay, so we know cognition can be affected, and we have ways or developing ways to measure it. Let's get to the why.
Yes, the mechanisms.
How could narrowed carotids actually cause cognitive problems if it's not a full stroke? What are the leading theories?
There are 2 main contenders right now. First, the idea of brain hypoperfusion, basically. Reduced blood flow to the brain because of the blockage.
Makes intuitive sense. Less fuel getting through.
Exactly, the hemodynamic theory. And the second idea is silent microembolic injury.
Tiny clots.
Tiny silent clots causing many damage over time. Let's tackle the blood flow idea first.
Okay, hypoperfusion.
Yeah.
How does the stenosis lead to that?
So as the plaque builds up and the artery narrows, the pressure of the blood flowing past that narrowing drops.
Yeah.
Now, the brain is smart. It has backups. It tries to maintain blood flow using collateral arteries, mainly this network called the Circle of Willis.
Ah, yes, the Circle of Willis, the brain's detour system.
That's a good way to put it. But here's the catch. Almost half of us.
Half?
Yeah, nearly half don't have a fully complete, fully functional Circle of Willis.
Really? I didn't know.
Yeah. And our own research, using computer models actually, shows that if you have one of these incomplete circles, a narrowing in the carotid artery can cause a much bigger drop in blood pressure in that part of the brain compared to someone with a good, complete backup system.
So the backup system is crucial. If it's weak, the narrowing has a bigger impact.
Absolutely. It's like having good detours versus no detours when the main road is blocked.
Makes sense. So what happens when that pressure drop gets bad enough?
Well, the tiny arteries inside the brain, the arterioles, they try to compensate. They dilate, open up as much as possible to keep the blood flowing.
The brain's fighting back.
It is, but there's a limit. They can only dilate so much.
Right.
If the narrowing gets too severe, or maybe if there are other stresses on the brain, eventually these little vessels just can't compensate anymore. They hit their limit.
And that's flow failure.
That's exactly what we call flow failure. The system can't keep up.
And can doctors actually see this happening? Detect this flow failure?
Yes, we can. One way is using transcranial Doppler, TCD.
Ultrasound for the brain's blood vessels.
Kind of, yeah. It lets us measure how well those vessels are reacting. We test their vasoreactivity.
Vasoreactivity.
Yeah.
Their ability to react.
Right. How well they widen or narrow. A common test is a breath hold challenge.
Holding your breath.
Yeah, briefly. Normally, that makes brain vessels dilate if they don't react much or don't dilate as expected.
That suggests a problem.
It suggests impaired vasoreactivity, a sign you might be near or at that flow failure point. And studies show at least half of asymptomatic carotid stenosis patients show this impaired response.
Half. That's quite a lot.
It is significant.
And can you actually see the reduced blood flow itself, like on a scan?
Yes, MRI can help visualize this. We can measure cerebral hypoperfusion.
Oh.
One method looks at something called time to peak, or TTP. We inject a contrast agent and measure how long it takes to reach peak concentration in different brain areas. A delay in one side compared to the other suggests slower, reduced blood flow on that side.
And you find this delay in carotid patients?
We do. Our research showed that in patients with severe stenosis, a TTP delay of just over half a second often means reduced flow in a good chunk of that brain hemisphere.
Wow.
And as the delay gets longer, say over 1 second or over 2 seconds, a substantial percentage of these patients have quite widespread hypoperfusion.
So severe narrowing, especially with maybe a poor circle of Willis,
equals higher risk of significant hypoperfusion. That's the link.
And is there evidence linking this hypoperfusion directly to cognitive problems?
Yeah.
Maybe from other conditions?
Absolutely. Look at congestive heart failure, CHF.
Where the heart pump is weak.
Right. Studies there clearly show that cognitive impairment often correlates with reduced cerebral blood flow. The brain isn't getting enough supply.
Okay.
And crucially, when you improve their heart function, maybe with a heart pump like an LVAD or a transplant,
and restore brain blood flow,
their cognitive function often improves too.
That's pretty compelling evidence for the blood flow connection.
It really supports the idea that maintaining adequate cerebral blood flow is vital for healthy cognition.
Okay, that covers the hypoperfusion theory. What about the second one? Silent microembolic injury.
Right, the tiny clots. Microemboli.
So, bits break off the plaque in the carotid.
Exactly. They travel up into the brain circulation, but because they're tiny, they often block very small vessels.
So no big stroke symptoms.
Usually not. No sudden weakness or speech loss. That's why we call the resulting damage silent brain infarctions. Tiny areas of damage, often unnoticed by the person.
But silent doesn't mean harmless for thinking.
Definitely not. That same Cardiovascular Health Study looked at this too.
Oh, okay.
They found people who developed new silent brain infarcts over 5 years. Well, they had a bigger drop in their cognitive scores compared to those who didn't.
So even unnoticed damage adds up.
It seems so. And other studies support this. The Rotterdam Scan study, for example.
What did they find?
They followed over 1,000 people. Those with silent brain infarcts at the start had a significantly higher risk of developing dementia later on. And new silent infarcts during the study were linked to declines in psychomotor speed and overall cognitive function.
So a clear pattern.
Pretty clear. Plus, if you already have evidence of old silent infarcts, you're more likely to get more infarcts, silent or symptomatic, and tend to show faster cognitive decline.
It's like death by 1,000 tiny cuts, almost.
That's a pretty good analogy for how it might work, a cumulative burden of small injuries.
Do we see this link in other situations too?
We do. Think about cognitive decline after some major surgeries like heart bypass.
Yeah, you hear about that sometimes?
That's often been linked to microemboli happening during the procedure, tiny bits getting dislodged and going to the brain.
Okay, but how clear is the link specifically for microemboli coming from carotid stenosis causing cognitive issues?
That's where it gets a little less certain compared to, say, the post-op situation.
Oh.
While it's a very plausible mechanism and many believe it contributes, some studies haven't consistently found a super strong direct link between detecting microemboli from the carotids and the degree of cognitive impairment.
So the jury's still out a bit on how big a role the microemboli play compared to hypoperfusion.
You could say that. Both are likely contributors, but the relative importance and the direct evidence for microemboli's cognitive impact from carotid stenosis alone is still developing.
Okay, that really paints a picture of the complexity. So we've got these theories. What about the actual evidence? What do studies show about cognitive function in people who have carotid stenosis but haven't had symptoms like a stroke or TIA?
Right, the asymptomatic group, that's key. And you're right to focus there. Most early research actually looked at patients after they had surgery or stenting.
Oh,
But now there's more focus on what's happening before any intervention in people just living with asymptomatic stenosis.
and what's the picture emerging from those studies?
It's suggestive. A review some years back, Baker's review, found a mix. Some studies reported kind of generalized cognitive dysfunction.
Across the board decline.
Yeah. Others pointed to more specific areas, taking a hip memory, learning, psychomotor speed, problem-solving abilities seem to come up fairly often.
Specific domains being affected.
Right. The Trumso study, for instance, linked carotid stenosis with lower scores, specifically in attention, processing speed, and memory compared to controls.
And does it get worse over time?
There's evidence for that, too. One longitudinal study followed patients for 3 years.
Okay.
It found that those with severe carotid stenosis showed cognitive deterioration over that period.
So it's not just static, it can be progressive.
It appears it can be, yes.
What about larger, more recent trials? Anything confirming this?
Yes, definitely. Look at the CREST-2 trial. Huge study, ongoing. They're doing cognitive testing. And the baseline data from the first 1,000 or so asymptomatic patients enrolled.
Yeah.
As a group, they had significantly lower cognitive scores than you'd expect in the general population, even before any treatment randomization.
That's pretty strong evidence for an association, isn't it?
It certainly points strongly in that direction, suggests that the disease process itself might be linked to some level of cognitive impairment.
And you mentioned earlier that blood flow issues, hypoperfusion, might be a key driver here.
We think so, yes. It's a central hypothesis.
Is there research directly linking measured blood flow issues to cognitive scores in these patients?
Yes, and that's where it gets really interesting. Studies that actually measure cerebral blood flow, or proxies for it, and correlate that with cognitive tests are providing crucial insights.
Like your own study?
Yes, in our study of 82 patients, never symptomatic, we found about half had impairment in at least 2 cognitive domains.
Half. Wow. Which domains mainly?
We saw issues most often in fine motor skills, processing speed, learning and memory, and those executive functions, planning, organizing.
Okay.
And importantly, this impairment seemed independent of other common vascular risk factors for cognitive decline, like just having high blood pressure generally.
And you found a connection to blood flow measurements?
We did. We found that having these cognitive deficits was significantly associated with having impaired cerebrovascular reserve, or CVR, measured by TCD.
CVR, that brain flexibility measure you mentioned. The ability to boost blood flow.
Exactly. That ability seemed reduced in those with cognitive impairment, suggesting that if the brain's plumbing isn't as responsive, it might contribute to thinking problems.
Have other groups found similar things?
Yes. Other research teams have also found that impaired CVR on the same side as the carotid stenosis is linked to a greater risk of cognitive decline over time.
Okay.
Another study followed patients with severe asymptomatic stenosis and found that those who started with impaired CVR showed the most significant cognitive decline over 3 years.
So the evidence linking blood flow dynamics, CVR, hypoperfusion, linking that to cognitive function in carotid patients seems to be getting stronger.
I think that's fair to say. It's a very active area, but the connection between cerebrovascular hemodynamics and cognition in this context looks increasingly robust.
Which leads us to the big therapeutic question.
Right.
If we fix the artery, open it up with surgery or stenting, can we actually improve cognition, reverse some of this?
That's the million-dollar question, isn't it? And the answer is, well, it's complicated, but potentially yes for some people.
Right.
The basic hope is that by restoring better blood flow, or maybe stopping those microemboli, we might allow the brain to recover some function. Animal studies do suggest that if you restore blood flow after a period of reduction, memory performance can improve, at least if it's not been too long.
So some nerve cell dysfunction might be reversible.
That's the hope, that it's not all permanent damage, especially early on.
Okay, let's talk treatments. What about that ECIC bypass you mentioned earlier? Less common now, right?
Extracranial, intracranial bypass, yeah?
Yeah.
It's a complex surgery, creating a detour around a complete blockage.
Did it help cognition in studies?
Some early work suggested it could. One study on patients with a total occlusion on one side and cognitive issues did show improvements in blood flow, vasoreactivity, and cognition after the bypass.
Yeah.
And a small randomized trial hinted at benefits, but only in a select group with proven hemodynamic compromise and no prior stroke. But yeah, it's not a common procedure for this now.
Okay, so let's move to the mainstays. Carotid endarterectomy, CEA, the surgical cleanout. What's the cognitive story there?
With CEA, the evidence is frankly mixed. Some studies do report cognitive improvements a few months after surgery.
That sounds positive.
It does, but there are caveats. Sometimes people just get better at the tests because they've done them before the practice effect. And if studies test too soon after surgery or don't have a proper control group not getting surgery, it's hard to be sure the improvement is real and due to the CEA itself.
Any studies showing no benefit or even decline?
Yes. In fact, one well-controlled study actually found a slight decline in the overall cognitive score in the CEA group compared to controls.
Oh, so definitely not clear-cut.
Not at all. Several systematic reviews looking at all the evidence basically conclude there's no consensus. Some studies show benefits, often in memory or executive function. Others show no change or even worsening. The reviews really highlight the need for better studies.
Better how?
Larger groups, longer follow-up, better control groups, and really accounting for other things that affect cognition, age, education, other health issues.
Right, isolating the effect of the surgery itself.
Exactly. And there's a growing hypothesis, maybe only patients who start with proven blood flow problems like that impaired CVR or hypoperfusion
Are the ones likely to see cognitive benefit from CEA.
That's the idea. Target the treatment effect. One small study hinted at this. It found improved blood flow and attention after CEA only in those who had reduced flow beforehand.
And are studies looking at this specifically now?
Yes, thankfully. Trials like CREST-H, CREST Hemodynamics, and ACCOF2 are designed specifically to test if baseline hemodynamic status predicts cognitive outcomes after revascularization. We should get better answers soon.
Okay, that makes sense. Target the intervention. Now, what about the other main option, carotid artery stenting, CAS? How does its cognitive impact compare?
CAS is also in that unresolved category regarding cognition. Similar uncertainty.
Pretty much. Like CEA, there's the potential for improvement by fixing flow or stopping emboli.
But also a potential downside.
But also the worry that the procedure itself might cause more tiny emboli during stent placement, potentially worsening cognition in some.
Right. What did the big comparison trials show?
Well, the CAVATAS trial, which compared CEA and CAS directly, looked at cognition. At 6 months, they found no significant difference between the two procedures in terms of cognitive outcomes.
So neck and neck, cognitively speaking, in that trial?
Pretty much. But then you have smaller studies specifically looking at CAS.
Yeah.
And several have reported improvements in various cognitive areas after stenting: learning, executive function, memory, verbal fluency, processing speed.
So conflicting signals again.
A bit, yes. One study using brain perfusion scans was interesting.
How so?
It found that patients who started with reduced cerebral blood flow showed significant improvement in both their blood flow and their overall cognitive function 3 months after CAS.
Echoing that idea about baseline flow being key. Exactly. It lends more support to that hypothesis. And in that non-randomized study we did comparing CEA and CAS, we actually saw significant improvements in composite cognitive scores after both procedures.
Both surgery and stenting helped in your study.
Yes, particularly in domains like learning memory, motor speed, executive function, language, and processing speed.
Okay, so maybe both can help, particularly if there's a flow issue to begin with, but we still need more certainty.
That feels like a fair summary of where we are. The potential for cognitive benefit seems real, especially for patients with demonstrable hemodynamic compromise.
Right.
But we absolutely need more high-quality, large-scale, long-term data to really nail down who benefits most, by how much, and from which procedure.
This has been incredibly illuminating.
Yeah.
A really deep dive into a complex but important connection. So, to wrap things up, what are the absolute key takeaways for us?
Okay, I think the main thing is this. The relationship between carotid disease and cognition is definitely complex. It's not simple.
Multiple factors involved.
Absolutely. Yes, carotid stenosis can restrict blood flow, cause hypoperfusion, and potentially impact cognition, especially if your brain's backup circulation, that circle of Willis, isn't great.
Okay, factor 1, flow restriction.
Factor 2, those silent microemboli, or another plausible mechanism, chipping away at brain function over time.
Right.
But, and this is crucial, you have to remember other things are playing a huge role too.
Like what?
Like just general atherosclerosis elsewhere in the body, your genetic predispositions, maybe underlying Alzheimer's type changes happening at the same time. It all interacts.
So it's rarely just one thing causing cognitive decline.
Almost never. But what is becoming clearer from all this research is that there's a real significant link between cerebrovascular hemodynamic problems, issues with brain blood flow related to carotid disease, and cognitive decline.
The blood flow connection seems key.
It does. And the really encouraging part is the possibility that fixing the carotid artery problem through CEA or CA might actually reverse some of those cognitive changes. It offers hope for improvement, especially, it seems, for people who have those flow-related issues to begin with.
But more research needed for certainty.
Definitely. The research is pushing forward hard, but we need those bigger, longer studies to really refine our understanding and figure out the best strategies for preserving cognitive health in these patients.
Okay, that gives us a really powerful final thought for you, our listener, to mull over. Consider this. If you or someone you know is noticing maybe subtle shifts, changes in thinking, memory, that cognitive sharpness, especially if their risk factors for artery disease present high blood pressure, cholesterol, smoking, diabetes.
Right.
It might just be worth a conversation with your doctor. Could there be a vascular component contributing? It's worth exploring.
It absolutely is. This whole deep dive just underscores how tightly linked our physical vascular health and our cognitive brain health really are.
Incredibly linked. A lot to think about.